This is chapter 19 in the Meredith textbook. There's a lot to talk about with blood vessels. There's different kinds that we've been talking about when I lectured on the heart. For example, for arteries, think about, on your last test, cardiac output, CO. It's the arteries that are distributing the cardiac output. Distribute blood. So blood vessels are simply containers for the blood. Arteries are the type of blood vessel that distribute the blood to like 1 billion capillaries. Starts off with one aorta, and it's going to branch and branch and branch and branch. And as arteries branch, a lot of those arteries have names, and we have to know those names, and I'll start lecturing on that on Thursday. So they're distributors. Then get to capillaries. We've been talking about capillaries. They're small, but they're many. So capillaries exist in beds. Capillary beds. They don't exist in isolation. Okay? It's kind of like safety in numbers. And the picture that you see shows pulmonary capillaries and systemic capillaries. They're an exchange medium. Metabolites, blood gases, fluids. I'll get into the specifics of that. Then you have to collect the blood after it's been spent or after you've had the exchange, and that's the veins. So the veins are a collection return system. I'll just say veins accomplish venous return. You return blood to the heart. So you have billions of capillaries, and the amazing thing about the veins is you have a lot of venules and small veins that have to collect all that blood, and they reform into two vena cava, right? Which you know, superior, inferior vena cava. We'll talk about all these things today. There's a lot of details. Here's an overview of the blood vessel system, similar to the picture we just looked at here. What's going on? Is someone outside? Oh, okay. Thanks. Well, anyways, this is basically all the blood vessels, and what we learned that's different from this one. We have blood vessels that are close to the heart, and they're called elastic arteries. Then you have muscular arteries. Then you have arterials. So there's different kinds of arteries, and I'll go through them all. You have small veins. You have large veins, okay? And here's the capillary exchange. So we've talked about arteries, capillaries, veins back to the heart. I haven't mentioned this one here. This is an arteriovenous anastomosis, something like that. In this example, you have a blood vessel that goes straight from arteries to veins, and you skip the capillaries because you cannot distribute your blood to all the capillaries all the time. You only do it to like what you're using. Like you increase the blood flow to the intestinal capillaries after a meal for digestion. You increase blood flow to the working muscles during your exercise. Okay, so you kind of distribute sparingly. You're circulating 5 to 6 liters of blood in the average adult. So that's not very much. So you have to like think about where you distribute it to. If you're going to bypass the capillary bed, and anastomosis can do it, you can go straight from artery to vein. You can go from artery to artery. Okay, you saw an example of that in the heart. Remember how you studied the anterior interventricular? What was one in the back called? Posterior interventricular. And they connected at the apex, okay, for that kind of collateral circulation. So you see examples of that. The other thing that I haven't mentioned here, see these little things there? They call them precapillary sphincters. That's a term I haven't used yet. Sphincters squeeze. In this case, if you're squeezing the smallest arteries called arterioles, blood's not going to go through there. Blood will not perfuse the capillary bed. It'll kind of like be diverted through some other thoroughfare channel. Okay, so you can shut it off, shut off the blood flow there if you so choose to. Another thing that's new is lymphatics. You get exchange of fluids in the capillary beds. However, the veins don't pick up 100% of the fluid that's filtered out of the arterial side. So all that excess fluid or edema has to be picked up by the lymphatic vessels. And so these smallest lymphatic vessels are called lymphatic capillaries, and they reform into large lymphatic ducts. Lymphatics. Pick up excess fluids from capillary exchange. And notice, as the diagram illustrates, you return that fluid to venous blood. Return. It's called lymph. When the excess fluid gets inside of the lymphatic vessels, we call it lymph. Lymph is fluid. Return lymph. Fluid to venous blood. So I'll put in parentheses, the lymphatics is contributing to the blood volume. So it's considered part of the circulatory system, which is why I'm mentioning it here in a blood vessel lecture. They're not blood vessels. They carry lymph, not blood. But they contribute to the blood volume. Now we have a whole chapter on lymphatics. I'll save the rest for that. I usually teach it during the immunity part of the course. Everything else we've talked about, arteries, capillaries, veins, back to the heart, that shouldn't be new. Now, so these other terms that are on the slide, I'll get to them. I thought what would be good to do is to start off with a discussion on blood pressure, because that's really the important thing about this whole course. Okay, it's one of the vital signs of life. Blood pressure. You measure, where do they put the BP cuff? Around your neck, around your waist, where do they put it? Everyone knows this. Around your arm. And you squeeze it, right? You squeeze that artery that's in there shut, and then you let the pressure out. You're trying to assess the blood pressure, and you use the pressure cuff to do that. Well, that's tomorrow's lab. And, so pressure is important. If you have pressure in your arteries, what you're saying is your patient's pressure is normal. Is you're saying that, oh, there's enough pressure in the artery to push blood to the capillaries. Okay, that's all you're really measuring it for, to make sure that that's normal. And so I want to show you the idea of why these vessels have pressure in them. It's a function of something we call volume compliance. It's really the arterial pressure that's important. That's the one you monitor in, say, your patients. This one. This is the pressure that pushes blood to capillaries. As long as that's happening, you get the capillary exchange, the tissues will not become hypoxic, everything will be fine. Okay. A lack of blood flow is ischemia. You want to prevent that to make sure you have normal distribution. I put this slide at the beginning. In anatomy, arteries and veins, they typically run together. Sometimes they have the same name, but blood is flowing in opposite directions. One is distributing blood to the organ or region. The other is returning it to the heart. Okay, but they run together, and would you have guessed that this is the artery? If you don't know, and I just have you guess, you might think this one is, oh, it's bigger, it must carry more blood. Actually, we're going to see it's not the case. Let me go through the properties of arteries and veins. And it turns out veins don't have a lot of pressure at all. Think about it. If blood circulates arteries first, then capillaries, then veins, it's the arteries that are close to the heart that benefit from the pressure the heart generates, which is, what's that top number during systole? About 120, right? So the arteries benefit from that. By the time you get to the capillaries and the veins, there's no pressure, okay, that the heart can help, because the blood is too far away from the heart by the time you get to the vein. Oh, anyways, we'll talk about how the veins can compensate for that. Here, let's just get an idea of the pressures we observe in arteries and veins. And in books, we always color the arteries. What color?
Red.
Yeah, that usually means oxygen rich, correct? Yeah, that's. And then blue is for veins. That usually means oxygen poor. You know, on a cadaver, arteries are like a whitish color, and veins are like this weird gray color. Okay, but you know, we'll stick with the red and blue. It's pretty. So you see the first and the last points here? That's kind of what I want to hammer first. The general concept for arteries and veins is that pressure is a function of volume capacitance for the vessel. Pressure is a function of volume capacitance. And students know what volume is. Like if you drink a liter of coffee, that's a lot of coffee. You know what volume is. Capacitance is how much does the container hold. Okay, how big's your coffee cup? You know, what's the capacitance? So don't let the word confuse you. And pressure is easy to understand. Understand that vessels is the vessel wall. And the hole is called the lumen. I've used that word before. And the fluid inside it, the blood, is exerting a pressure against the wall. And that's the pressure that's important. That's the pressure that pushes the blood forward to capillaries or returns it to the heart. So for arteries, I usually describe them as a stiff vessel. They're look at the bottom point, they're small capacitance. They don't actually hold very much blood. A stiff vessel with a small capacitance. They don't hold very much. If you look at a pie chart, you have about 5 liters of blood in the average adult. At any given time, about 15% of that 5 liters is in the arteries. So when I say small, it's only about 15% of the blood that's... Of course, blood is constantly circulating, but if you could freeze frame it, about 15% is in the arteries at any given moment. So think of it this way. Let's pretend you have... I mean, if you look at the caliber of this tube, it's kind of small compared to the big vein. So, you know, that has a small capacitance. So I'll say small volume. And I'll write small volume in small letters to symbolize they don't hold very much blood, 15%. However, this volume of blood, this 15%, is large for its capacitance. Therefore, you observe high pressures. This volume is large for its capacitance. Therefore, you observe high pressures in blood, in blood vessels that are arteries. Observe high pressures. In arteries. Small volume, large pressure. So I'll draw pressure in big letters. Pressure. Pressure is high. And the textbook average that I've been giving you is like 120 over 80, right? That's our normal high. Expressed as two numbers. 120 millimeters of mercury over 80. The millimeters of mercury, as I said, is the unit of pressure in medical sciences. Right? In physics class, they usually use pascals. Well, I kind of use the standard millimeters of mercury. If you want to express that as one number, take an average. What you can't do is take a mathematical average. What's the average of 120 and 80? 100. But as you know, I think, the heart spends some time in diastole and some time in systole. And that said, it broke down. The systole is like 0.3 of the 0.8 cardiac cycle, right? And I said the diastole is 0.5 of the 0.8. That's what I said. So you can't take a mathematical average if you're spending more time here, right? So it's like, I'll show you later. If you want to express this as one number, it comes out to be like 93 millimeters of mercury. Textbook average. It's enough pressure to push blood from the arteries to the capillaries. Okay. So this volume, this 15%, it's small, but it's large. It's filling up the container. So the pressure in the tube is high. Any questions on that? That's a really important concept. They have high pressures. They don't hold a lot of blood, but that volume is large for its... I always think of like a water balloon because it's summertime. The goal of the water balloon is to throw it at someone and it bursts. So you want to fill it right before it pops, right? If you fill it too much, it pops in your hand at the garden hose. So if you fill it up just right, you know, it's about to, that's like, I think that's like an artery. Now how much water is in that balloon? Not very much, but it's large for its capacitance, so when you throw it at someone, it bursts. So if there are no questions, veins are the opposite of this. So if I'm saying opposite, let me describe vein. I'll describe vein as it's a very compliant vessel with a large capacitance. A large vessel with a large capacitance. If you took a regular sized balloon opposed to a water balloon and you could fill that thing with a lot of water. It can hold a lot. Turns out for veins, they hold about 60% of blood at any given time. 60%. Sometimes we refer to veins as your capacitance vessels. They have the capacity. Or blood reservoir. You got all the blood. What's a water reservoir? You put a dam, you got all the water behind it. Okay. A blood reservoir. I've seen that term used. Because the veins hold most of the blood. And if you look at the picture in cross-section, you can see why that's true. Okay. So, in veins, we'll draw the tube a lot bigger, right? They hold large volumes, but this large volume is small for its capacitance. So large volume. But they could hold a lot more. Okay? So you observe low pressures. Low pressure. Let me write that statement out. So this large volume, percent is small for its capacitance. So we observe low pressures in veins. You know, in like the vena cava, maybe pressure is like 1 to 3 millimeters of mercury, hardly any. In the larger veins, 1 to 3 millimeters of mercury, very, very low. Okay, so that's the main thing about the whole volume capacitance thing. I have some other things here that are differences between the blood vessels I think you should know. Have sheets of elastic fibers. That third point from the top there under observe high pressures, this point here. Arteries have sheets of elastic fibers. Well, veins do too. However, I'm thinking of the arteries that are close to the heart, like the aorta or the brachiocephalic trunk or the subclavian arteries. Blood vessels that are closest to the heart, arteries close to the heart. These are vessels that have hot blood in it. What's core body temperature? 98.6 degrees Fahrenheit. For example, the femoral artery. If you were to slice that and feel the blood coming out, you burn your hand. It's 98.6 degrees Fahrenheit. It's hot. So these vessels that are close to the heart, they have the hot blood, but they also have many sheets of elastic fibers. And we know what elastic is. It's stretchy. So this allows for a recoil effect because blood is pulsating, right? Blood flow is not like turning on a faucet. You turn on a faucet, that stream, it's not pulsing, it's a steady flow. But because the heart goes systole, diastole, it's pulsatile. And so you want to be able to kind of like stretch and then recoil. This elastic recoil would occur while the heart is in diastole. And that keeps the blood pushing forward in one direction because the heart's not generating any pressure during diastole. So this elastic recoil keeps it going. Keeps blood moving forward. That makes sense, right? And what's the number for diastolic blood pressure? At the bottom, 8. It's not 0, right? It drops to about 80 and you get the next systole. In the heart, it drops to 0, right? Almost. But in arteries, because of this, it kind of like keeps up pressure. I say moving forward toward the capillaries. How come not backwards? Yeah, the valve closes, right? Which valve? Aortic semilunar valve. So think about that. Let's see here. Oh, okay. Let's see for veins. Arteries don't have valves throughout their length. They have the one valve, the aortic semilunar. The veins throughout their length have valves. You don't see a valve there. But because we observe low pressures and the heart isn't providing pressure for it, the valves will prevent backwards flow of blood. So veins need valves. They're like the SL valves. They're very similar. They close and they prevent backwards flow of blood. All right, the other thing, the next point, arteries have thicker walls usually. So I'm not talking about the diameter of the entire vessel, which includes the lumen. I'm talking about just the thickness of the wall itself. Look how thin that wall is, even though the whole diameter is bigger. The wall is thinner vein compared to artery. And I don't know if some of you use scissors to cut through one of your arteries, like the pulmonary artery or the aorta. It's about 1 millimeter thick in arteries. Well, anyways, veins have thinner walls. You might want to note that. A lot of times, the thickness is due to many layers of smooth muscle cells. Thicker due to vascular, smooth muscle cells. Veins, they have vascular smooth muscle cells too. I don't want you to think that they don't, but usually in arteries, they have more of it, which is responsible for maintaining blood pressure too. Okay, the other thing about arteries is they're usually deep, and that's for protection, deep in the body part. There are a few places where you can feel them. That's where you can take a pulse, right? Radial pulse, the carotid pulse, and the femoral pulse. Down here in the tibial arteries, so there are a few places in the body where you can take a pulse, and that's where the artery is closer to the skin surface. But for the most part, they're deep for protection. Veins have, they can be superficial and deep, and or, you know. It's like the veins I see in my hands and my arms. Those are all veins, and there's not arteries that run with them. And the superficial ones that you can see that are skin deep, that's good for heat dissipation. Okay. On a hot day, you want to increase blood flow to the superficial veins to dissipate heat to we call it the ambient air, the air around you. The deep ones the deep ones usually run with the arteries. Okay. But you do have superficial veins with no accompanying arteries. And okay, so that's kind of it for my comparison of just the arteries and the veins. Those are the key differences. So what you learned, you probably didn't know before, is veins hardly have any pressure in them. And they hold most of the blood. We're going to study histology of the arteries and veins, and we can look at pictures like this and ask a question at the top. Why do veins have a much higher compliance? I guess consider their geometry. Usually they're shaped like this, like an oval or ellipsoid shape. I mean, oval shape in cross section, right? So if you have a shape like this, and you're filled with blood in the middle, a large volume, that volume is large, but it's small for its capacitance. You could expand if you're flattened. You could kind of get more circular shape, right? You become more like that. Imagine the amount of blood you can hold now. That's what I mean by geometry. Go from more oval to round. And the remarkable thing is, if you look at the data, we won't. You don't even see a jump in pressure too much when you go from oval to round. They're pretty compliant in that way. All right, moving on. All right, here is a pressure graph. It's in every physiology textbook here. And what I did was, I just kind of eyeballed it, and I tabled out all the pressures you can observe from heart, aorta, arteries, arterioles, the capillaries, and then your collection and return system, the veins. And you can see how pressure starts high, and it drops off to almost nothing by the time you get back to the right atrium. Okay? And I want you to know the difference between mean arterial pressure and pulse pressure. And you should be able to calculate it. So let me show you how to do that. So as you look at that, what should come across to you is that Where is gas exchanged? Which kind of blood vessel? Capillaries. That's what changes from red to purple to blue. And notice that arteries are important for their pressure, but not the veins. They don't have pressure, so of course they're not important for that. So when I talk about calculating pressure, it will be for the arteries. Okay? Mean arterial pressure. I'm going to abbreviate mean arterial pressure MAP. Let's say it equals the diastolic blood pressure plus 1/3 of pulse pressure. Okay, well, I better tell you what pulse pressure is. When you feel a pulse, to get heart rate, you're feeling each little pulse you feel is a pulse pressure. You're feeling the difference between the top number and the bottom number. Okay? So, pulse pressure, the difference between those two is simply the systolic BP minus the diastolic BP. So to solve this, I have to give you data. Let's say, for example, you measure 120/80, our textbook standard. And it's always millimeters of mercury if I don't say. Okay? First, calculate pulse pressure. What is it? 40. And for the same thing, 120/80, now you can solve mean arterial pressure. It's the diastolic, which is 80, plus 1/3 of 40. Okay, so you can solve that. It's going to come out to be close to 93, right? So if you want to express it as one number, about 93 millimeters of mercury. Depending on the numbers I give you, but now you know how to calculate. Okay. And so we kind of see that when you're close to the heart, in the arteries, close to the heart, shown here. That's why you kind of have this up-down thing in there. Now this is all squished together, this one up, down. But what that is, I'm going to fast forward a couple of slides and show you what it is. You see the aortic pressure that we've been talking about, the green line? Imagine if this is squished. And then you get, this. So that's it. That's the up-down, 120/80, right? And then if you take an average, there's the line, right? The mean pressure. It's not a mathematical average, right? Because you spend more time in diastole. So there you go. And that's kind of what you have. You notice you get a really large drop-off in pulse pressure and absolute pressure when you get to arterioles. So pulse pressure, I told you, when I say absolute pressure, I just mean pressure. Okay? It's 93, but by the time you get to capillaries, it's like 30/20. It drops off really quick. And so when you get to capillaries, there are no pulse pressures. When you get to veins, still no pulse pressures. Think about it. A small blood vessel could not handle a pulse. It would just burst. The wall is too thin and it would just burst. So that's why the arterioles kind of resist that, and you lose a lot of pressure in arterioles, and there's no pulse pressures in the arterioles. All right, let's move on. So the veins don't have pressure, not a lot, but they do hold a lot of blood, so they're called your capacitance vessels or blood reservoir. So just look at a pie chart. I had said they hold about 60% of blood. The arteries have about 15, and you can see how the rest is distributed in capillaries, pulmonary circulation, and coronary circulation. The heart is a single organ. It has a lot of blood circulating in it at any given time. So here on this slide, I'm saying the large arteries, how are they able to maintain diastolic blood pressure while the LV is in diastole? I've already answered it. Look at diastole. Look at the pressure of the ventricle. It's less than 10. It's almost 0. Okay, so but look at the pressure in the aorta. It stays really high, about 80. Okay. And I've already answered the pressure. The answer to the question is that arteries have a pressure reservoir. It's like a second pump because of their elasticity. So just say arteries close to the heart have a pressure reservoir. Don't confuse it with the blood reservoir term I use. That's for veins because they have most of the blood. Pressure reservoir means you have a source of pressure when the heart isn't generating pressure. Okay, that's the elastic recoil that I mentioned earlier. Think of it as a second pump. That's not the heart. Here's a picture illustrating it. When the heart's in systole, it generates the pressure. It pushes blood through the semilunar valve. You stretch out the elastic arteries. That's the reservoir. You push the blood forward. So that when the heart is resting, blood flows backwards for a moment. It closes the valve. Okay, and that along with the elastic recoil, you push blood in one direction. Okay. So the elastic recoil is simply squeezing the tube so blood can continue to flow forward towards the capillaries. That's the pressure reservoir function. So to define all the cell types in arteries and veins, we kind of use the term tunics. Tunics are layers. And this figure usually does a good job of teaching students all the different cell types and layers. So basically, to teach the layers, you have 3, 2, 1. 3 refers to the tunics. 3 tunics, 3 layers. 2 tunics, 2 layers. How many layers do capillaries have? Down to 1. Okay, so I got to teach it what the tunics are. I kind of did this before when I taught the heart wall. Remember how I taught like the pericardium, the myocardium, and the endocardium? This is the same. In fact, you know, you can think of like endocardium as being the same as the innermost layer of a blood vessel. Tunica intima. So let me teach the tunics of the vessel wall. So let me be clear about what a vessel wall is. If you look at the cross section of a blood vessel, as we've been doing, the vessel wall is only the layers between right there. See if you're paying attention this morning. What did I call this space for where the blood is flowing? Lumen. Yeah, lumen. So, you know, I'm talking about the tunics. And so let's go in to out. Let's go tunica intima, the innermost layer. It touches the blood. I go TI as an abbreviation. Tunica intima. Some folks are now calling it tunica interna. That's okay too. I usually go with tunica intima. And if I could kind of draw all the cells like in more of a wall and not so much in a circle. The endothelial cells that line the tunica intima are flat and squamous. So we categorize it simple squamous ET, but we call it endothelial cells or endothelium. That's the main thing of the tunica intima. Endothelium, comprised of endothelial cells. Endo means within. ECs for short. It's a simple squamous ET. It lines the inside of your blood vessels. ET is epithelial tissue. So it's an epithelium. The endothelium is an epithelium. Okay? Now I just kind of drew it as a flat surface. Imagine there's blood flowing right on top of it. It's flowing in that direction. So if I go from inner to outer, I'm going to like draw underneath it to represent outer layers. Within the tunica intima, there's a subendothelial layer. It's just connective tissue. Use green, or how about blue? It's just loose ET, loose connective tissue. That's all it is. You know, the larger blood vessels, which have all three layers, they'll usually have an internal elastic lamina. How about I use purple for that? It's almost black, but purple's a dark color. I'm going to draw like a squiggly waistband, right? You can stretch it because the internal elastic lamina is elastic tissue. Call it the IEL for short. IEL, which stands for internal elastic lamina. All of that is considered TI. We'll move on to TM. Tunica media, TM. So if you're following along on the figure, the TI, there's endothelium. I like how they illustrate the endothelial cells. It's very accurate. The subendothelial layer, they draw the internal elastic lamina to look like Swiss cheese. That's okay. Usually on histology slide, it's black. Black elastic fibers is usually what you'll see. TM, it's basically many layers of smooth muscle cells. It's the muscle layer. Many layers, SMCs. That's smooth muscle cells. They're spindle-shaped cells. It's like a solitary spindle-shaped cell with a solitary nucleus. And when they contract, they kind of bulge up like that. But they're arranged in a circle, and you have many of them. And I don't want to draw a bunch of individual cells. Let me just draw like many red lines to symbolize many layers of smooth muscle cells within the TM. Now, not illustrated, but what we'll see, intermixed with the smooth muscle cells are sheets of elastic cells, elastic fibers, within the TM. So you also have, depending on which arteries you're talking about, many elastic fibers. How about I'll stick to the purple for elastic. So, you know, I'll draw some purple lines within the red line to symbolize they're there too. That's the elastic recoil we're talking about. And that's the TM, those two cell and fiber types. Present in both arteries and the veins. Okay. The one thing I'm not illustrating is the venous valves. And they're not illustrating it there either, but they're in there. Well, there's a valve right there. They don't show it at the top, but they show a venous valve inside there. Okay. And the other thing they show, what do you think the up arrow versus the down arrow refers to? The direction blood is flowing. They're usually together, arteries and veins, blood is flowing in opposite directions. Okay, so moving on from TM to, if you're a large vessel, you also have the TA, okay, the outer layer. That's tunica adventitia. You can go with tunica externa, then you have to call it TE, but I usually stick with TA. Okay. It's kind of like an overcoat. It just kind of keeps it, the blood vessel, contained and attached within the body region. Okay. It's comprised of collagenous connective tissue. I'll just say connective tissue basically. How about I use green? TA. Lots of connective tissue. All right, so one thing I want to mention is the blood flows in the lumen. That blood may provide nourishment for some of these top layers, maybe TI, maybe into a little bit of the TM. But these outer layers, these cells need nourishment too. So the outer layer of this blood vessel has little blood vessels in it, little arteries, little veins within the TA. I'll draw a little artery there. I'll draw a little artery here. Little vein, I guess, to go with it. Okay. And those little vessels of the vessel are called the vasovasorum. They're contained within TA. This layer here, TA. Okay. Vasovasorum. The vessels of the vessel is what that means, right? So that way there's blood supplied to the outer layers of these three layers, so to speak. You can see this with the naked eye. Remember I said arteries are like whitish? So I see these like tiny red like fibers on the outer layer. It's really beautiful. In fact, I had an embalmer in here. And, you know, what embalmers have to do is they use the arteries to inject the fluids for a funeral service. And you have to tell an artery from a nerve from a vein. If he sees the vasovasorum, he knows it's the artery. I mean, veins have them too. They're just not as apparent because of their gray color. Anyways, a little side note, but know that these are providing nourishment to the blood vessel. The cells that don't have access to the blood that's flowing through it. Okay. So that describes all three layers. Now, of course, not all of the blood vessels have all three layers, so I'll have to go through that. But are there any questions on just the tunics? The TI, the TM, or the TA? Know those. You'll have to be able to identify them. Well, let's start with talking about the entire cardiovascular system, starting with arteries to capillaries to veins, and we'll go through all the details here. You have figures like this in your book that can be helpful. So what are they trying to show you? They're trying to show you a picture, a little section of a vessel. They give you some stats, diameter and thickness, diameter of the whole vessel versus thickness of the vessel wall. And they give you like a little histogram. I like it. Students usually hate histograms, but in one glance, I could see why they call these muscular arteries. What's the biggest bar? Smooth muscle. Okay, so that's kind of why I like it. So endothelium, elastic tissue, smooth muscle, with a collagenous tissue. I mean, I talked about all that, so let me erase this now. You should start with the heart, but we already had a test on the heart, so let's start with the largest arteries close to the heart, which are called the elastic arteries. That's a category of arteries. Now, elastic arteries are sometimes called conducting arteries because they will conduct blood to major regions of the body, like head, neck, upper limb, lower limb, you know, conducting arteries. So AKA, also known as conducting arteries, they will conduct blood to major regions. Well, for example, brachiocephalic trunk. It's a good example of a conducting artery. That blood vessel will conduct blood to the head neck region. Example. Brachiocephalic trunk. Conducts blood to the head neck region. And so they're about, you know, the biggest one is the aorta. It's like 2.5 centimeters in diameter. They're big, you can see them, is the point. And the key thing I've been harping on, I think, why are they called elastic arteries? They contain lots of elastin. I'll say elastic tissue. And I've already mentioned it, this is for that recoil function, right? The second pump, the pressure reservoir. I've said it many different ways today. The pressure reservoir, the recoil. So that's why they're important, okay? So they'll provide the elastic recoil. Let's move on. The arteries branch out, right? We can call arteries branches, but not veins. Veins don't branch out. Veins, they reform into larger veins. We call arteries branches, we call veins tributaries, if you want to use the correct terms, okay? Well, anyways, you branch out into smaller muscular arteries. Look at the caliber is shrinking. 6 millimeters. You could see that with the naked eye for sure, right? We've already pointed out why they're called muscular arteries. Proportionally, they have the most smooth muscle. However, they're also called distributing arteries. For example, one of the branches off the brachiocephalic trunk is the external carotid artery. I can't get the words out. Example, external carotid artery. It's a branch of brachiocephalic, as we'll see, and it'll distribute blood to the neck, external skull. It distributes blood within the region. External carotid artery distributes blood within a region. So they have a lot of vascular smooth muscle. That's their key feature. Let's keep track of the layers. Elastic arteries. Got all three. TI, TM, TA. muscular arteries. Got all three layers, TI, TM, TA. And the muscular arteries you can see with the naked eye. So, I mean, that's a kind of annoyance for anatomy students because we've named them all. You have to know the names for the elastic arteries and the muscular arteries. When you branch out to the smallest arteries called arterioles, they're too small to see. They don't have names. Okay? So the arterioles, you're down to two layers. So the question becomes, which layer did you drop? Do they have TI, TM, no TA? TI, TM, no TA. That means the outermost layer is what? TM. The outermost TM. And look at the picture. What are they illustrating there? The outermost layer, you can see, those are all smooth muscles. They're commonly called your resistance vessels. These are the ones where you can really clamp down to increase blood pressure. I mentioned before, pre-capillary sphincters. If you clamp down on those sphincters, you increase the resistance for blood to flow. That'll keep blood in the arteries. That'll keep arterial pressure up. Here's a picture of that. If you clamp them, you increase resistance to blood flow. Some gets through, but basically you're keeping more blood in the arteries. That'll help maintain blood pressure. So when you do this, they constrict, call it vasoconstriction. All blood vessels can vasoconstrict. I'm just saying it's most effective at this level. That's the basic idea. Vasoconstrict, increase BP. Because this is how blood is flowing out of the arteries. So if you kind of resist blood flow, you keep more blood in the arteries to help redistribute blood to, say, working muscle beds or vital organs like brain and heart and lungs. Those are your vital organs. Okay. Here's a picture of the cardiac muscle. So I want to kind of look at the histology of the blood vessels, but I got to start with the heart. I'm just going to pump blood into them. On the histology quiz, I'll just say identify tissue. You say cardiac muscle. Why is cardiac tissue an incorrect answer? That's a common mistake on a histology quiz. Remember there's 4 tissue types? Epithelial, connective, muscle, and nervous. So when I say identify tissue, you have to tell me which of the 4. If you just say cardiac tissue, you're not telling me which of the 4. Okay, it's muscle. Why can't you just say muscle? Well, aren't there 3 types of muscle? There's smooth, there's cardiac, and there's skeletal. So you have to say cardiac muscle. I need both words. Look for the striations, multinucleated cells. I point to a couple intercalated discs. Can you see them? Fade it a little bit. Well, look for the vertical dark bars. Okay, those are the intercalated discs that have the gap junctions and the descent zones, as I mentioned. Well, anyways, from the heart, you pump blood into elastic arteries. So I point to TI, you really can't see it, but you know where it would be, right? This big wall of cells. So the top of it is TI. This is all TM. I mean, I bracketed it out for you. You should see 2 colors, red and black within here. You see that? So the red is the vascular smooth muscle. What did I say the black was? Elastic fibers. So you can see that the high content of elastic is why they call them elastic arteries. Okay, this is probably an aorta, although I'm not for certain. Here's TA. It's kind of like a loose collagenous connective tissue. And I see little blood vessels in it. Basal vasorum. Here's a low mag, that inset over there, and I'm pointing to the basal vasorum right there. So here it is close up. So this is a TA. It's the basal vasorum that you see in the TA. Here's a muscular artery. I got 3 arrows because you still have 3 layers. Identify tunic. T, I, T, M, T, A. From inner to outer. Okay, so notice that the squiggly black line is our IEL, internal elastic lamina. Notice how the TM is more pink, right? Because it has more muscle and less elastic, although there is, see the little black lines? There is elastic tissue, it's just not as much. More elastic tissue in the TA, I think. Okay. Here's a muscular artery. You know what I do is, these aren't from the internet. I just went to my collection, and they're not labeled on the slide either. I just look for the simple clues that are in your book. If I see 3 layers, I know, based on caliber and the 3 layers, it's a muscular artery. Okay? So with very little knowledge from the textbook, you can figure it out on your own. And that's the whole point of histology. What are the red cell, the black cells in there? Red blood cells. Okay. All right. So again, I was like, well, how am I going to show them in arterial? Where do you find it? Well, I happen to know that one of the things we teach, you have the central arteriole in the spleen. So by definition, it's an arteriole. Notice how it's purple? What stains purple? It's white. It's white pulp. What kind of cells is the white pulp? White blood cells. White blood cells are really white, but they stain purple. And this is how the spleen works. All the blood coming into it, through the arterioles, they're surrounded by a cuff of white pulp that can help fight blood-borne infections. But anyways, I'm more concerned that you know this as an example of an arteriole. TI, TM, no TA. So you got a couple of layers of smooth muscle for the TM and your endothelium for the TI. Okay. For the capillaries, they are the thinnest. Oops. I think capillaries is a good spot for a break. Let's break until 11:30. Continue on with capillaries.